Welcome to our YouTube channel Vikiran Drishti. Today I am live with new lecture series in Radiology and Imaging Technology. The topic of the lecture is Radiation Safety in Interventional Radiology. Those who have not subscribed this yet, please quickly like, comments and subscribe so that you keep getting notification of all new videos. Let's start now. Hello learner. Good morning, good afternoon, good evening. Today the topic of my lecture is Radiation Safety in Interventional Radiology. Let's start. Introduction. Radiation is a form of energy which doesn't require any medium for its propagation. It can be categorized into head. One is ionizing radiation and other is non-ionizing radiation. Non-ionizing radiation either shows little or no direct effect on living organism, whereas the exposure to ionizing radiation can cause a number of health effects, including skin damage, cancer, and birth defects. The risk of adverse health effects increases with the amount of radiation exposure. In recent years, interventional radiology has advanced rapidly, resulting in a significant rise in the number of procedures performed. However, there is increasing concern about radiation exposure affecting both patients and operators during these interventions. Radiation exposure to both staff and patients should be minimized by adhering to the ALAR principle, which ensures optimal radiation protection by keeping exposure as low as reasonably achievable. X-ray equipment in interventional radiology. A fluoroscopy system, commonly utilizing a CRN, plays a crucial role in real-time imaging during interventional procedures. In this system, X-ray photons generated by the X-ray tube pass through the patient's body, with varying degrees of absorption depending on tissue density. These photons are then captured by a flat panel detector, which converts the received X-ray energy into electrical signals. Analog-to-digital converters, ADCs, process these signals, transforming them into digital images. Vendor-specific software further refines, enhances, and displays these images on a monitor, allowing radiologists and clinicians to visualize internal structures dynamically for precise diagnosis and treatment. Next. Importance of radiation safety. X-rays belong to the category of ionizing radiation, meaning they have enough energy to penetrate body tissues and potentially cause cellular damage. Prolonged or repeated exposure to X-rays can lead to cumulative radiation doses, increasing the risk of long-term health effects, such as tissue injury or radiation-induced conditions. To mitigate these risks, modern X-ray systems are equipped with advanced technology that records detailed radiation dose reports in milligrays, mgV. Continuous monitoring of these exposure levels is crucial to ensure the safety of both patients and medical staff. Adhering to radiation protection guidelines helps minimize unnecessary exposure while maintaining diagnostic accuracy. Next. ALAR principle. A as L low, A as R reasonably, A achievable, ensures radiation exposure is minimized while maintaining diagnostic quality. Next. Key radiation safety measures. Time. Effective time management is essential in reducing radiation exposure during imaging procedures. One crucial approach is utilizing pulsed fluoroscopy mode, which minimizes continuous X-ray exposure by emitting radiation in short bursts rather than a steady stream. Additionally, exposure duration should be carefully adjusted based on the patient's age, medical condition, and the necessity for repeated imaging to avoid unnecessary radiation. Instead of continuous imaging, healthcare professionals should review the last image hold (LIH) feature, which retains the previous fluoroscopic image for reference, reducing additional exposure. For digital subtraction angiography, DSA, frame rates should be optimized according to the specific anatomy being examined, ensuring high-quality imaging while minimizing radiation dose. Next, key radiation safety measures, distance. Maintaining an appropriate distance from the radiation source is a fundamental principle of radiation safety. According to the inverse square law, increasing the distance between a person and the X-ray source significantly reduces radiation exposure. For instance, doubling the distance decreases exposure by a factor of 4. To enhance safety, non-essential personnel should maintain a minimum distance of 3 meters from the X-ray source whenever possible. Additionally, positioning the flat panel detector as close to the patient as possible helps optimize image quality while reducing unnecessary scatter radiation. Furthermore, using extension tubing and power injectors allows medical staff to operate equipment from a safer distance, minimizing direct exposure to ionizing radiation. Next, key radiation safety measures, shielding. Proper shielding is a critical component of radiation protection, ensuring the safety of medical staff and patients during fluoroscopic procedures. Wearing a full lead apron and a thyroid collar is mandatory for healthcare professionals involved in fluoroscopy, as these protective barriers significantly reduce radiation exposure to vital organs. Sealing suspended shields and lead drapes provide additional protection by blocking scattered radiation, particularly in high-exposure environments. When hands must be placed within the radiation field, lead gloves should be worn to prevent unnecessary exposure. Additionally, lead-lined eyewear is strongly recommended to protect the eyes from radiation-induced damage, such as cataract formation. Next, additional safety recommendations. Proper optimization of X-ray settings is essential to minimize unnecessary radiation exposure while maintaining image quality. Collimating X-ray beams ensures that radiation is focused only on the specific area of interest, preventing exposure to surrounding tissues. Utilizing grids helps filter out scattered photons, improving image clarity and reducing unnecessary radiation. Adjusting the X-ray tube voltage to the highest appropriate level decreases radiation absorption, enhancing safety without compromising diagnostic accuracy. Whenever possible, avoiding magnification mode helps lower radiation dose, as it increases tube current and exposure. For prolonged procedures, repositioning the X-ray tube periodically helps distribute radiation more evenly, minimizing the risk of localized overexposure and potential tissue damage. Next, special considerations. Certain precautions must be taken to protect vulnerable organs and individuals from excessive radiation exposure. Radiosensitive organs, such as the eyes, thyroid, and gonads, should always be shielded to prevent potential long-term damage. Children and adolescents require special attention, as their developing tissues are more susceptible to radiation effects, making it crucial to minimize their exposure whenever possible. Regular equipment inspections must be conducted to ensure that all X-ray systems function correctly and comply with safety standards. Additionally, quality control measures, including dose tracking and routine data reviews, should be implemented to monitor radiation exposure levels and improve overall safety protocols. Next, estimated radiation exposures. General public, 1 millisievert per year from natural sources. Radiation workers, 5 millisievert per year, dosimeters required. Radiation sickness threshold, 500 milligray, single exposure. Cataract risk, 500 millisievert, cumulative dose. Lethal dose, LD, 50 by 35,000 milligray, single exposure. Interventional procedures, typically 1 milligray to 50 milligray. In last come to the conclusion. Radiation safety is essential for protecting patients and healthcare staff. Following ALAR principles minimizes unnecessary exposure. Time, distance, and shielding are key protective measures. Regular monitoring and compliance ensure safe practices in interventional radiology.